My name is Ronald Galiwango, and I'm the co-lead for the modeling as well as the air quality work streams of the COAST project. Yes, starting with the modeling work stream. This is work stream 3 of the COAST project, and we are tasked with modeling COVID-19 as well as the interventions for COVID-19 in a bid to help policymakers to make decisions as regards to the effect of the epidemic. Maybe I'll begin with giving the objectives of the work stream, and they are threefold. So the first is to aggregate data from the other work streams so as to derive modeling parameters. And the second one is to do the actual modeling, both the mathematical and statistical. And lastly, to develop a dashboard that the policymakers can use to form, to make decisions on what to do next. So over the last 1 year, we've acquired data from the different work streams. For example, the radio data from the radio mining work stream, and also air quality data from the air quality work stream. So we're also having discussions with other work streams, for example, the chatbot team. And we've developed the mathematical model as well as the statistical model. And we are training it on data from the Ministry of Health. We've also used parameters from the literature that we could access. And over the past couple of months, the last 2 months, what we've been doing is to develop the dashboard. And so far we have what we could call the first draft of the dashboard. Starting with the opportunities, so we're able to access data on use of antibiotics, which was actually not part of the actual plan, but through our collaborations, we're able to get pharmacy data, and we developed a manuscript that we submitted and is in line for publication. Going to the challenges, most of them have something to do with the data, because our objective was to do the modeling for different districts in Uganda, but so far the sort of data that we access from the Ministry of Health is mainly country level data. So if we could only get our access to district level data, or maybe even go high resolution and say sub-county, that would inform our modeling very well. In terms of outcomes, what we expect is to have our dashboard developed and deployed such that policymakers, wherever they are, for example, all the different stakeholders with regards to COVID-19, the funders, the government, and then maybe other researchers, they could access the dashboard and then sort of predict by themselves what is going to happen, for example, in the next couple of weeks. And then they use that information to tailor the interventions that they have to deploy. In the next phase of the project, we hope to now use the actual parameters that we got from the different work streams, because in the first phase what we were doing was to obtain parameters, for example, things to do with how are people observing adhering to SOPs set by the ministry, and then also things to do with the transmission rate, how is the epidemic spreading. So most of those things we are getting them from the literature, but now in the next phase what we are doing is now to obtain those statistical summaries, or what we are calling parameters in the modeling language. We hope to get them from the other work streams. So for example, we are getting the proportion of individuals who are willing to get vaccinated from the radio mining work stream, and we're also obtaining a parameter that is going to modify the transmission rate from the Google Community Mobility Reports. These are data for how people are moving, and we think this will modify the transmission rate. So the other thing we are doing is the actual deployment of the dashboard and improving it. And lastly, the dissemination in the form of policy briefs, blogs, and a manuscript. We've concentrated on 2 districts in Uganda, which is Kampala and Wakiso, and we've obtained air quality data from the AirQO project for Kampala and Wakiso, and also Google mobility data from the community mobility reports, so that we see and track movement in these areas. And also we've obtained weather data for these 2 districts from a project called TAHMO, and we've analyzed all this data, and our main emphasis was to determine if air quality could be used as a measure of movement because of the weaknesses or the limitations of using cell phone data. It comes with a lot of ethical challenges, things to do with how are you tracking, where are you tracking individuals? So that comes with ethical challenges, but also, when you're using cell phone data, people can easily switch off their GPS location, and that means you cannot track their movements anymore. So what we've been doing is that we did work to test if air quality can be used as a measure of movement, and we've actually published our work with regards to that. Yeah, so some of the challenges we faced, they are similar to actually what we are facing in the modeling workstream. So data, because like I mentioned, what we want to achieve in this workstream is to derive vulnerability indices for each of the districts. But unfortunately, the COVID-19 data that we are getting is not stratified by district. So most of our works have been at national level. But in terms of opportunities, is that we are planning now to use the data that and some of the results that we've obtained to apply for more funding to do other works. So for example, we want to see at national level, in terms of the air quality that we are seeing, how does that relate to other disease outcomes beyond even COVID-19? Because it has been implicated in many respiratory pathogens. So we are using some of our results as preliminary data to seek for more funding. Now we are scaling up to national level. So like I said initially, we are looking at Kampala and Wakiso, but now we obtained air quality data for each of the districts in Uganda where the AirQO team has these sensors deployed. So whatever we are doing in the initial phase, now we are scaling it up. So at the end of it all, we shall be having vulnerability indices for each of the districts, so that we see which districts are doing well in terms of air quality and which ones need to improve. From our works, we've observed that during the COVID-19 lockdown, when government instituted the stay-at-home orders and also limiting human movement, so we saw that air quality actually improved during COVID-19. But what is interesting is that even after that improvement, we are way high above the WHO threshold in terms of what maybe acceptable air quality should be. So we hope that the results of this work would be used to, could be taken up by individuals at population level. So for example, things to do with behavioral change, such as we know most of our air quality sensors were tracking vehicular movement, things to do with how are people moving, the vehicles they are using, because some of the sensors are put, for example, on taxis and border borders. So if there was a policy, for example, of individuals taking up more public transport, that will be helpful because it will reduce on the number of vehicles that are moving, because buses and taxis usually take more people compared to a private car. So that will be helpful in terms of reducing the air pollution. But in terms of policy, now, so if we have these vulnerability indices, policymakers would actually, for example, have a visualization of the dashboard that we've developed, and they see which regions in real time need to be acted upon. For example, where should the money be put such that individuals, are helped in making informed decisions? Maybe the other thing would be the AirQO project developed an app, that tracks how bad the air is. So if individuals would install that app and move with it, because nowadays almost everyone has a smartphone, so that would help in terms of which regions they should avoid and what they should do in terms of improving air quality. To the funders, thank you so much for enabling us to do these interesting works. Most of the outputs that we've derived are life-changing in terms of, we've just had things to do with improvement in air quality, reduction in the number of COVID-19 cases, and policymakers being able to make informed decisions. So without the funding that you provided, all these things wouldn't have been possible. So thank you very much for that.